Good morning, everyone, and welcome to another installment of Flex University. My name is Josh Graham. I am the sales manager here for our group sales consultants with Flexible Benefit Service Corporation. This morning, we're going to be discussing a new platform, I should say newer platform. It's really gaining traction within our market right now called Blue Directions. The platform that we're going to speak about today is strictly for your small group clients, any of your ACA regulated small groups, so 1 to 50 market. My goal really is just to make sure you understand the system and how it really operates in your favor, creates efficiencies for you as an agent within a market that tends to be more and more competitive and moving towards a more digital age. Before we get started, I'd like to just kind of give you a quick overview and note that any questions that come up along the way can be added into the chat function on the right-hand side of the screen, as well as in the Q&A section, and we'll address those individually at the end of the presentation. Now, Flexible Benefit Service Corporation was founded in 1988. We are locally in Rosemont, Illinois. We have roughly 75 employees and 2 primary business focuses. Our general agency, which many of you work with us for, as well as our consumer-driven accounts. So that would be our FSAs or HRAs, COBRA administration, etc. As a general agent, our goal is to provide excellent service and sales support to you as agents. To do that with multiple insurance companies to keep you efficient as a broker in the marketplace today. We represent Blue Cross and Blue Shield of Illinois. Obviously, that's what we're talking about today. But for medical on the group side, we also operate Aetna and United Healthcare products. For ancillary coverage, we have a ton of different carriers, which are true general agency contracts, meaning 100% of commissions are payable directly to you, and we receive an override, obviously, for our services, supporting you, answering questions, and doing a lot of the data entry. For ancillary, we represent MetLife as one of our newest contracts, the Standard, Principal, Delta Dental of Illinois, VSP. We have exclusive sheet rates with them, very easy to sell, nice way to boost revenue on some groups that are struggling to continue to maintain certain commission levels for you. So a lot of different options that we can support within our general agency to help you grow your business. One thing that many employers are asking for, and definitely products that agents in the market need to be aware of and comfortable talking about, are these consumer-driven accounts, health savings accounts, flexible spending accounts, health reimbursement arrangements. We have a ton of tools available on our website at flexiblebenefit.com that can actually compare the differences between these 3 products side by side, help kind of explain it in layman's terms that kind of supports the employers that really don't understand what goes on in our market and how these products work. So it's just a nice tool for you as an agent to utilize. We just launched a brand new technology for these products, which is going to allow us to be more efficient, more user-friendly when it comes to online applications, mobile applications, etc. So that would be for our flexible spending accounts, health reimbursement arrangements, HSAs, commuter plans. We're doing that again, COBRA administration, and then other compliance services like wrap documents and premium-only plans to pre-tax premiums. We have the option for some of these products to offer either a debit card or cross-tech with Blue Cross and Blue Shield. We have a benefits portal, as I mentioned, a mobile app, a lot of efficiencies available to you. A full implementation and claims as well as service staff is available to you for any of these products that you sell here with Flex. We are one of Blue Cross and Blue Shield's approved vendors for HCSC in Illinois, Texas, Oklahoma, New Mexico, Montana. So we are available to choose from on the your BPS when you enroll in a group with Blue Cross, as well as through the Blue Directions system, which we'll show you in just a bit. All right, so I'm going to go ahead and jump into Blue Directions. The first part of this presentation will be kind of the high-level overview about the program and what it can do for you, employers, and employees. And really, before we jump into it, we got to focus on the opportunity at hand for us in the small group market space. Many of you are aware there are some uncertainties in the individual market right now, And we're trying to figure out exactly how we're going to structure our business to navigate those. That's a lot of the feedback I'm getting from many agents that I speak with. Obviously, there's network challenges, and we anticipate that to continue into 2017, even more so. There are potential rate increases that many of you have seen filed that we are waiting to see if they get approved as high as they are. There's some uncertainties within commissions, and you've seen some carriers say they're not going to pay commissions at open enrollment. We anticipate some will, but we don't know exactly what that's going to look like. And what that's creating is obviously some volatility within our market and causing individuals to either approach their employer that doesn't offer coverage and ask them to offer something so that they can have access to the health care that they need. It's causing some individuals to incorporate and create businesses in order to meet some of the requirements. And what we found is that a lot of individuals actually do already own their own business, and they're able to expand that and start creating a new group health insurance policy from there. So a lot of new groups are being created, and because of that, we need a solution available to us to be a little bit more efficient with our time. I can tell you personally that a 2-life group will take you the exact same amount of time to write as a 20-life group. 20-life groups run a lot better throughout the year, less questions and things like that. Now, Blue Directions is going to create some efficiencies for you to bring those smaller 1- and 2-life groups on and really make it easier to onboard it, to the degree of potentially not even having to go out and visit them if that's your business model. So we're still going to see some challenges. One of the other reasons that groups are on the rise is a little unknown but known period of time called the special enrollment period, which is going to open up here November 15th. On November 15th through December 15th, you are able to submit to any carrier here in the state of Illinois and really nationally that falls into the small group market space and submit that case without the carriers being able to deny coverage by not meeting participation or by not contributing to the health plan. So this is the only time out of the year where you could truly offer a voluntary medical product at no cost to the employer, giving access to the individuals to that particular network that they want within a particular carrier that they want, and the employer doesn't have to pay for it. You're basically providing access to your employees. We actually just recently created a letter that you as agents can brand, and you can send out to your individual clients to take to their employers to start generating group business. If you're interested in that, contact us. I can get it over to you, but it's something that you should be doing now and really filling your pipeline for next year. That pipeline, obviously, you should be ready to rock and roll November 15th because we really do anticipate dramatic increases in the number of small group sales here for January 1st. In addition to that, for the employer, the premiums that employees pay, even if it's 100% voluntary, can be run through a Section 125 cafeteria plan, which means that not only does the employer not pay any money, they're actually going to save money based on lower payroll taxes. So there's a lot of benefits for employers, and this letter that I mentioned kind of lays that out for them. And I think that an employer will be more willing to listen to their employees struggling to gain access